My name is Stacy Dietrich. I grew up in Mobers, South Dakota, which is a rural community in the Midwest, and I would like to talk to you about my experience as a registered veterinary technician, and I am currently in education in Roswell, New Mexico. As a registered vet tech, I was responsible for everything the veterinarian can do except perform surgery, diagnose, and prescribe medications. So essentially, a registered veterinary technician is like a registered nurse for people. So I was responsible for patient care, surgical, um, like the surgical ward, assisting in surgeries, prepping patients for surgeries, radiographs, um, doing lab work, putting in IV catheters, giving injections, giving medications, triaging, collecting histories, helping with wellness exams, and obviously a lot of cleaning is involved. A typical day in the vet clinic consists of, you're there anywhere between 7 and 8 o'clock in the morning. You start your morning out turning on your lab machines, checking on your patients, making sure everybody's clean. If they need medication, you're responsible for giving the medication. You are documenting everything in the medical records. You may be talking to clients. Sometimes you're answering the phone, helping the receptionist out, making appointments. You might be filling prescriptions. You're getting the surgical ward ready, and that can be anywhere from putting your surgical packs together, your autoclaving. Sometimes inventory is involved where you are ordering supplies for the clinic, and just kind of helping the vet stay on track and just making sure the patients are taken care of. Sometimes, if you've been there long enough, you are responsible for supervising and training new hires as well. My favorite part of the job is probably getting to see all the animals coming in and helping them get better. And then when they do get better and you send them home, just seeing the clients, and especially if they're, have kids and stuff, how happy they are. But I also like medicine, so I really enjoyed doing like the blood work and kind of helping figuring out what is going on with everybody. I kind of got my start on the veterinary side. I grew up out in the country, and so we always had animals around, and I kind of had a soft spot for them. And from the time I was 4, I always told people I was going to be a veterinarian. One of our neighbors was a veterinarian. They were good friends of ours, and so we really got to see things. My folks, if we took our animals into the vet clinic, as kids, we would go along and I would ask questions because I just really wanted to know. And then our farm cats, I would start when they would catch prey, I would take the birds and the mice away and would nurse them back to health. So when I became a freshman in high school, I decided that, we were able to work. So I was working for a job, and I started out kind of in a cafe. It wasn't quite my thing. And one of the gals that went to our church, her husband, they were new in town, and he had taken over the local vet clinic. And so I had just asked if they had a position, kind of what I was interested in. And I had gone in and I had interviewed. Instead of freshman in high school, I started out cleaning kennels. And that was mainly my job. I would go in after schools. I worked 7 days a week, and I loved every minute of it. There were days they had to tell me to go home. And so I worked there up through graduation to a senior. And by the time I was a senior in high school, I was going on country calls with the vets. I was assisting. I had asked questions. I was helping doing lab tests. I would help with cattle C-sections, which was by far my favorite. And then we would get sick calves in. And so I learned how to take care of the sick calves and, how to encourage them to bottle feed. And I mean, I kind of just immersed myself in it because this is what I had wanted to do. And after I graduated high school, I went to a college because my major was going to be a veterinarian. So I looked for a college that had pre-vet. Well, they didn't have pre-vet like I thought they did. So I went to Northern State University in Aberdeen, and I was a member of the high school rodeo team at the time. And so I was still kind of getting magazines and things. And there was an advertisement for a college in Curtis, Nebraska called Nebraska College of Technical Agriculture. And they offered a veterinary technology program. And I thought, I could do this. I could start out being a vet tech and then, eventually lead into going on to veterinary school. I had graduated in 97, and part of our program was an internship. And I kind of wanted to be down south because I got tired of the Midwest winters. And so I took an internship in Hobbs, New Mexico, working with Dr. Don Newman at Hobbs Animal Clinic. And I did well enough that it just led to my job after I graduated. They'd hired me on. I stayed on for 4 years. I had met my husband while I was living in Hobbs, and then we had moved to Roswell, and then I started working for College Garden Animal Hospital, and I stayed there for 15 years. And while I was working at the for Dr. Albert and Dr. Humphreys, one of our associate veterinarians was teaching a vocational program out at Eastern New Mexico University, and it was a veterinary assistant program for students with disabilities. Well, she had asked if I would be willing to co-teach with her, and I thought, why not? It might be fun. And that led me into teaching. And so I had done that for 15 years while working in the vet clinic, and national exams, because to be a registered vet tech, you have to pass those exams in order to be certified by the state. And so I passed the national and the state exam, which allowed me to be a registered vet tech. And then with that, I joined our New Mexico Registered Veterinary Technicians Association, and also the North American Veterinary Technician Association, which covers all vet techs kind of through the state. And one of the things, while I was a member of both associations, I was fortunate enough to be the what we would call the NAFTA state rep for New Mexico for 2 years. So I got to represent the state of New Mexico as a registered vet tech through the North American Veterinary Technician Association. As you can kind of figure it out, I never did pursue going on to be a veterinarian, because I thought, being a vet tech, I've got the best of both worlds. I mean, I have a little bit more free time. I still get to do what I love, and I don't have near the pressure that the veterinarian has. As far as my high school experience, because I knew what I wanted to do at a young age, so I made sure that I took courses that were going to be in line with what I needed for college. So I stayed mainly on the science, the biology tracks. My extracurricular activities in high school, I played volleyball until I started working at the vet clinic, and then that just kind of consumed everything I wanted to do. I was involved in high school rodeo, college rodeo, and I did a lot of horse shows. So most of my hobbies involved, working with the animals, doing stuff. I made sure that whatever I did in my high school career would follow me into my college career, but would set me up with good study habits. And I stayed pretty well on track with, this is what I want to do. What do I need to achieve it? And I laid out some goals for me, and I just made sure that nobody or anything was going to distract me from that. So I always had to make sure, am I making a good choice? They always say, if you find your passion and that's what you get to do, you never really work a day in your life. And the whole time I was working in the vet clinic, every day I went in, it was a new experience. The routine's the same, but you never know from day to day, what's going to come in. Is it going to be a hit by car? Are we going to have, a mama dog coming in and we get to help deliver babies? Is it, a cow coming in? What kind of surgeries are we going to do? Find your passion and you turn it into a career. It never feels like you're at a job. And it's like anything. You'll have days where you get down or things don't always go well. But I just, like, literally, when your bosses have to tell you to go home at the end of the day, it's not because you don't want to go home. It's just because you love what you do, and you just keep thinking, I can do this better, or I can make this better, or just one more patient. And you just keep going.